Welcome to page 47 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The deep muscles of the back and posterior neck. Now these can be very complicated and a lot to remember, but I'll try to help you organize them as the author has in groups, and perhaps that will help ease some of the stress of remembering these muscles. Let's start out with the deepest muscles. Deep underneath. The deepest muscles are starting with the neck. Let's start with the suboccipital muscles. These are muscles that are in this area right here, underneath all of these layers. First, the Obliquus Capitus inferior. Oblique because it runs sideways, not vertically. It runs obliquely on both sides. It runs from the transverse or the spinous process or lamina of C2 up to the transverse process of C1. And it, judging by the path it runs from here to here, it actually pulls the transverse process of C1 around and rotates C1, rotates the neck here. Rectus, capitus, posterior, major. Well, rectus means straight. So it's going to be running more up and down, not as oblique, and that's this muscle right here. Rectus, capitus, posterior, major. And it runs from C2 all the way up to the skull, all the way up to the occipital bone. This is the occipital bone here. Part of the skull, it's the back of the skull. That's the line of the occipital bone, and it actually runs deeper than that as well. And it's attaching to, so it passes C1, rectus, capitus, posterior, major. Rectus means straight, major because it goes from C2, passes C1, all the way up to the occiput. Rectus, capitus, posterior, minor is rectus because it's straight. Minor because it only crosses one joint. It only goes from C1, the posterior tubercle of C1, to the base of the occiput. So rectus capitus posterior major because it's longer and goes from C2 all the way to the occiput, and minor because it goes from just C1 to the occiput. And it doesn't cross two vertebrae, or doesn't cross two joints. Now, Obliquus capitus superior. Obliquus capitus superior. Oblique because it is not straight, it is slanted. And it goes from the tip of the transverse process of C1 and attaches to the occiput, the base of the occiput. Now, Obliquus capitus inferior is a tiny little muscle that I'm not sure we can even see. It would be running somewhere after we just completed the suboccipital muscles. The Obliquus capitus superior, Obliquus capitus inferior, and both of the rectus muscles, rectus capitus posterior major, rectus capitus posterior minor. So those are deep underneath these big neck muscles right here. Now, how about the deep muscles of the rest of the spine? the deep, deep muscles of the rest of the spine, you have the intertransversarii. Intertransverse. That means between the transverse processes. Aha! I see it right here. Here's a transverse process of a vertebra here, and here's another transverse process here, and running in between them, is the intertransversarii muscle. Here's another look at it here. Running between the transverse process, or the wings of the vertebrae. Tiny, tiny little muscles as deep as you can go. Next, the interspinalis muscle. The interspinalis means in between the spine, or in between the spinous process, how about? And sure enough, here's a spinous process here, and here's one here, and here is the interspinalis muscle running between each spinous process. So here you have the interspinalis muscle in between each spinous process, all the way up and down the spine, even into the cervical spine. Very, very deep in between each spinous process vertebra of the vertebra. Now, we've done the suboccipital muscles, the intertransversarii, and the interspinalis. What do these muscles do? Well, the interspinalis extends the head back, or extends the entire spine back, and by pulling each vertebra close next to each other, by pulling downward and upward and squeezing this vertebra together, it will extend the spine backward. The intertransversarii will bend you to the side. Look, if these little transverse muscles decide to squeeze down this way and up this way, well, the vertebra is going to bend together into lateral bending, or lateral flexion over to the side. And just to be sure, the interspinalis muscle, if it's pulling one vertebra down here and pulling the other up here, it's going to pull the back into extension. And the suboccipital muscles do rotation and extension as well. The oblique capitus inferior being the biggest rotator, and the rest being pretty much extensors of the spine. The ones that are more oblique, like rectus, capitus, posterior, minor, or major, it does run a little laterally here, although not as oblique as this one. I imagine it does some rotation as well. So, moving on to the next layer, let's move to the oblique muscles. As I discussed with you, oblique, here's rectus. Rectus is straight up and down. Oblique is off to the side. So let's talk about some of these oblique running muscles. First, the deepest of them, the rotatory muscles. Deep, deep, deep in the spine, almost as deep as the intertransversaria, are these rotatory muscles. Rotatorys. And what they do is they run from the transverse process of the vertebra below, the TP, to the spinous process, the SP of the one above, just like so. And they run kind of, I believe, in a zigzag fashion like that, but they run, the point being that they go from the one below to the one above. Because the next muscle we're going to talk about, the multifidus, does the same thing. These are called Transverso Spinalis group. Why? Because they go from the transverse process to the spinous process. Just like I said here, the Rotatorys muscle goes from the transverse process, say of T12 here, to the spinous process of T11. And you can see its job is going to pull in this direction and rotate that vertebra around. Next is the multifidus muscles. Multifidus are basically very similar to the rotatorys, except that they'll skip a level. They'll skip from, say, the transverse process of L4 up to the spinous process of maybe L3 or L4. And in a similar way, you can see that they also have leverage for rotation. If it wants to, this multifidus muscle wants to pull down at this oblique type of angle, just like the rotatory muscle, it's going to wind up pulling the vertebra around, but at a lesser, with less strength, because it doesn't have as much leverage as the rotatory. But you can see, because of its oblique nature, just like the Obliqus Capitus inferior down here was almost sideways, it's going to be a rotator of the neck, of the head. And so the more oblique the muscle, the more rotation it's going to impart on the spine. So you can see that the oblique muscles, the Transverso Spinalis muscles, from the transverse to the spine, to the spinous process, are in fact rotators of the spine. These are your rotators of the spine. But there's one left. It is the Semi-Spinalis. And the only difference here is that first we had the Rotatorys, which are very sort of sharply, they go from one vertebra to the next. We from the transverse of one to the spinous of the next one up. We had the multifidus that can possibly skip a couple levels. They'll skip like so, maybe even 3 levels like that, from the transverse of 1 to the spinous process of 2 or 3, well above. The Semi-Spinalis will do something similar, and it might go 3, 4, 5, 6 vertebrae above. So the only difference between these two, the Semi-Spinalis, the multifidus, and the Rotatorys, is how far they can reach. And the Rotatorys are deeper, the multifidus are almost as deep, and then the Semi-Spinalis are more superficial. But the difference lies in the reach. How far do they reach? How many vertebrae above do they reach to? Semi-Spinalis from the transverse process of, let's say, T, 12, 11, 10, 9, might reach up all the way to, 6, 5, and 4. So the difference is in their reach, the Semi-Spinalis, and so they're all rotators. And they also will do some extension as well. The more vertical they get, the better they are at extension, pulling the spine back into extension. But they're the oblique muscles because they go from the transverse process of one vertebra to the spinous process of the one above, and they simply extend farther. The rotatorys are short, multifidus reach a little farther, and Semi-Spinalis reach even farther. And they are the oblique muscles, or the muscles that are slanted, so to speak, in the spine, from the transverse process to the spinous process. Next layer up, moving more superficially, the big, huge, massive muscles of the back, starting from the pelvis and the sacrum here, and the sacral vertebrae, and the lumbar vertebrae here, and rising from the thoracolumbar fascia is this group of muscles called the vertically running muscles, not the oblique ones here, but the more vertically running muscles. So we'll start from the outside in. We have this muscle called the Iliopostalis Iliopostalis muscle. The Iliopostalis. Why do you think it's called the Iliopostalis? Because it comes from the ilium area here and extends, what does costal mean? All the way out to the ribs. The costal, Iliopostalis, working from outside in. The Iliopostalis muscle. And that's the muscle number 1 of the erector spinae or spinae. The Iliopostalis muscle. The next muscle, and again, originating from the pelvis and the thoracolumbar fascia and even the lumbar vertebra. The next muscle originating, erector spinae muscle, originating from this thoracolumbar fascia, this tendon, this deep tendon down here, and the lumbar vertebra here, is the longissimus. Look at, and why do you think it's called longissimus? Look how far it reaches. It's the intermediate muscle in between, it's this longissimus in between the erector, the spinalis and the iliopostalis. And it has a vast, it's very, very long, probably is the most massive muscle in your middle back. And then it comes to insert at the vertebra of the thoracic spine, and even there is a version that comes all the way up into the neck right here, or actually that's the Iliopostalis Cervicis. This is the Iliopostalis Cervicis, but there is also a longissimus cervicis that makes its way also up into the neck as well. So both the Iliopostalis and the longissimus, each of them have a very, very far reach from the ilium and the lumbar area, sacroiliac and the lumbar area, to the ribs, and then continuing, and this is Iliopostalis here, Iliopostalis cervicis will climb all the way up here and into the neck as well, as will the longissimus. So that's the longissimus cervicis is called right there. This is called longissimus thoracis. Longissimus thoracis. This is Iliopostalis thoracis. Iliopostalis. The ones down here you might call longissimus lumborum. And up top, you would call that the longissimus cervicis. Iliopostalis thoracis, IC thoracis. And you would call this branch that reaches into the neck, you would call that the Iliopostalis cervicis. So moving from outside in, Iliopostalis thoracis, longissimus thoracis in the middle, and then this one right in here of the vertical muscles of the erector spinae, the spinalis muscle. Keeps it spinalis. Why? Why do they call it that? Well, because it stays nice and close to the spine. And it originates from some of these lumbar vertebrae up here, and then inserts into some of the thoracic vertebrae up here. So it stays pretty close to the spine. Now, some of these spinalis muscles, there are also spinalis muscles. These ones, they stay really close to the spine. This is the spinalis thoracis. There is actually a spinalis cervicis as well. Stays nice and tight and close to the spine. Very vertically oriented, running up and down. But, as a matter of fact, so there is spinalis cervicis, and then there is Spinalis capitus, which goes straight to the head as well. So Working out in, once again, the Iliopostalis from the ilium thoracis, from the ilium to the thoracic. Well, it has a branch called Iliopostalis Cervicis as well, and it goes up to the neck. The longissimus cervicis, coming off of the thoracolumbar fascia in the lumbar area, certainly in attaching to these thoracic vertebrae, in here, not the ribs. And it also has longissimus cervicis. Well, the spinalis muscle does not come all the way down here into the thoracolumbar fascia. It originates in the upper lumbar and then finishes here right in the thoracic, and then has two different versions. The spinalis cervicis and the spinalis capitus. Capitus means the head. Capo, the head of something. So 3 sections of those. The other muscles of the oblique muscles, the transverso spinalis, of the erector spinae, they only have 2 sections for the most part. But the spinalis has the 3. Okay. In that it has a section that goes to the head. And the job of these erector spinae is to extend the spine. You can tell they're vertically running muscles. They're straight vertical muscles. If they pull this way and this way on your spine, your back's going to come back into extension and arch your back for you. And lastly, moving up, and I should tell you that the rotatorys and the multifidus, by the way, they run all the way up the spine. These oblique muscles run all the way up the spine. They rotate all the way into the neck as well and underneath those muscles. And of course, here you see the Semi-Spinalis Cervicis and the Semi-Spinalis Capitus. Not to be confused with the Spinalis Capitus. But you can see them, these muscles, the oblique muscles, running all the way up into the neck and head, and all the way down to the sacrum as well. The outermost layer, there's one more layer to top them off, and that is this muscle right here, the covering muscle. We call it of the neck. And it's called the Splenius Capus. Capitus because it goes to the head. Splenius, I think Splenius means like a wrapping of some sort. Anyway, you can see how it runs to the sort of obliquely to the head. And then we have here the Spinalis Cervicis, also kind of an obliquely running muscle. And they are the top layer of muscles in the head and neck. So they would run right here and then right here as well. Splenius. Yes, splenius means a bandage. So it's almost like a muscle that runs like a bandage around in the manner of a bandage. So because it has this oblique angle, if it pulls from here there, it's going to wind up extending the head and then rotating it back and rotating around. So the Splenius Capitus and Splenius Cervicis are rotators of the head. Rotators. Of course, they will also extend the head back as well. So rotators and extensors. So that is a general overview of a very difficult topic, the deep muscles of the back and posterior neck. And it really doesn't do it justice. Each of these muscles should probably be parsed out and taken and handled on an individual basis. But if you organize them in terms of verticality, or whether they're straight up and down or off to the side, in terms of whether they're deep or superficial on top, and in terms of whether they're more lateral on the outside or more medial on the inside, between those 3 categories, you can get a good handle on the muscles of the back and posterior neck. This is Dr. Stephen Harkins, and page 47 of Anatomy Coloring Book.